The federal government has installed Dr. Joss Reimer as Canada's new Chief Public Health Officer at a time when public trust is fragile and accountability is long overdue. So let's look at who Dr. Reimer is and what her track record signals about the direction of Canada's public health leadership. Let's dig in.
I feel more concerned now than I've ever felt about the misinformation environment, but I want that to be a driver for change.
Starting on April 1st, Dr. Joss Reimer will be stepping into the role of Canada's Chief Public Health Officer, vacated by Theresa Tam late last year. Notably, Dr. Reimer was a useful narrative enforcer when she led Manitoba's vaccine task force during the height of the COVID madness. She was the former president of the Canadian Medical Association, the CMA, and is now positioned to be the top doctor calling the shots on national health policy. After years of lobbying the feds on everything from censoring harmful content online, anti-racism, government-sanctioned euthanasia called medical assistance in dying, and Indigenous reconciliation efforts, she's taken her efforts now to crack down on so-called misinformation.
So I wanted to spend a little bit of time on misinformation because that was sort of the bane of my existence throughout this vaccine and what I really had to fight against all the time. And unfortunately caused a lot of harm, has always caused a lot of harm, but it was quite pronounced during the vaccine campaign. So we did a survey in Manitoba early on when only about 10% of Manitobans had been vaccinated. And we found that about 60% of people were keeners. So like they were going to get the vaccine as soon as they could. We really didn't need to talk them into it all. There were 12% of people who were what we called accessible, like they'd get it, but they'd get it when they got it. 10% of people were not sure. And they had some concerns, they needed to think about it. And then another 10% of people were just absolutely not getting it. And it's really tempting to focus on the anti-vax folks, those who are inaccessible, but we call them inaccessible for a reason. It doesn't matter how much communication we do. We are not going to reach most of those people. And when we focus all of our attention on them, we miss out on the accessible folks and the skeptics, where we actually could make a difference. And we might miss out on the keeners. So we really didn't focus much time on the people who were against the vaccine and tried to spend much more time on folks who weren't sure. And there were so many myths and so much misinformation, and there still is. There's still lots of stuff about infertility. There's stuff about how it's going to ruin your immune system. It's an experiment that everything got rushed. We didn't do all the usual studies, even though we did. That it's not safe, that it's going to harm your children. When the childhood vaccines came out, the online messaging about harming your children was overwhelming. It's hard to blame people for being worried about the vaccine when some communities got targeted online. Like there was active, intentional targeting of certain communities to try to push the anti-vaccine messages there. And if that's all you're seeing online, and you might occasionally hear from me somewhere on the radio, like of course you're not going to 100% just buy into what you hear from me once when you've seen these terrifying looking memes and just false statements that are so convincing.
It seems Reimer is okay overlooking early 2021 data highlighted by immunologist Dr. Byram Bridle on things like the Japanese biodistribution study, which showed that the lipid nanoparticle fat bubble components that hold the modified RNA actually accumulate in vital organs, including the ovaries and uterus. A 2023 peer-reviewed paper also acknowledged that a complete picture of vaccine biodistribution remains unclear, noting some evidence that components may persist in the body for months and cross certain biological barriers like the blood-brain barrier and blood-breast milk barrier. More recently, animal studies have reported reductions in ovarian reserve in rats given human equivalent mRNA doses, including significant loss of primordial follicles. That's the foundation of fertility. Nonetheless, rewarded for her mis- and disinformation spewing, Dr. Reimer has inevitably joined the very establishment she's been cozying up to for years. According to the Hill Times, Reimer says her top priorities in this new position include tackling the same mis- and disinformation she's been spreading. Or I guess she actually means tackling those actually exposing the risks and the evidence instead of clinging to dogma and marketing slogans. We don't have to look any further than her comments from June of 2021 during peak COVID hysteria, when Dr. Reimer went on CTV News and casually referred to the pandemic response, specifically mixing and matching vaccines, as part of a big human experiment. Yeah, she straight up called it a human experiment, and now she wants Canadians to trust her to police what counts as truth in public health, decide what information is acceptable to share, and to shape national policies that will affect all Canadians. Jump ahead just a month later to her July 2021 COVID update presser, where she peddled blatant misinformation, saying that the vaccine studies weren't fast-tracked at all, but rather it was just the rollout that was sped up.
Canada has one of the best vaccine monitoring systems in the world. And we use the information that we gather and the information from countries all over the world to guide our decisions. So we've seen that happen when it came to the use of AstraZeneca and the very rare but serious side effects of blood clots with low platelets. We've seen it as well in the even rarer reports of myocarditis, first observed in the US and Israel, just to provide a few examples. So I know it can be a challenge to wade through all of the information out there about vaccines, especially when you have questions. But I do want to correct the information and make sure people know that these vaccines were tested, they were approved, and they were shown to be safe and effective in the same way as other vaccines. The science behind these vaccines is solid. It's built on technology that we know and that we understand.
Newsflash, we all remember Operation Warp Speed and how these jabs were rushed through trials, not to mention the scale up of manufacturing, which led to major changes in the process used, undisclosed DNA contamination, and raised further questions about transparency, quality control, and regulatory oversight. Yet there was Dr. Reimer reassuring everyone that everything was by the book. If that's not gaslighting, I don't know what is. And speaking of denial, let's talk about vaccine injuries. As a result of multiple regulatory failures, a growing number of Canadians have reported serious adverse events, but are left navigating a slow, opaque compensation system, while officials like Reimer repeat the marketing mantra of safe and effective without acknowledging the complexity of risk. The Federal Vaccine Injury Support Program, called VISP, was handed off to Oxero, formerly RCGT, over their perceived conflicts of interest. Yet now the Public Health Agency of Canada is set to take control over the program under Reimer's leadership. For those who have been dismissed or sidelined, that doesn't exactly inspire confidence. In her previous role as president of the Canadian Medical Association, Reimer essentially dismissed the existence of people suffering from vaccine adverse effects, suggesting some claims are just made up. Can you imagine? Thousands of Canadians have come forward with stories of life-altering injuries post-jab, and here's the Chief Public Health Officer in waiting basically saying they're delusional.
And while I wouldn't say a lot of people knew people who had had bad outcomes with the vaccine, they'd all seen pictures of people. They weren't real people most of the time, but they looked like real people. And so they saw what looked like these young, healthy people who had had these severe outcomes. And so it felt like they knew people who had had severe outcomes from the vaccine, even though most of them were not true. Misinformation or disinformation spreads way more easily than true information because it is emotional, because it offers simple explanations. So while I have to go through and explain like how mRNA works and why the mRNA doesn't hang out in your body and what spike proteins are, and like you don't need any of that if you're not bothering with the truth. You can just come up with whatever simple explanation you want and you're done.
Again, blatant misinformation saying mRNA doesn't hang out in your body when it's been shown that, in fact, it does. I think Reimer needs to inform herself on the difference between messenger RNA and modified RNA, the latter of which is the mechanism employed in these injections. And let's not forget her chumming it up with Theresa Tam at a Canadian club event last January, discussing how healthy is Canada's information environment, action, in the face of misinformation. They were patting each other on the back about combating fake news in health, with Reimer even saying that it's a matter of life and death, citing a mother who refused a blood transfusion due to concerns about vaccinated blood. Except that it sounds like the mother was guided by actual evidence-based information, rather than the misinformation Reimer warns of, considering the unknown risks to infants outlined in the COVID-19 vaccine monograph, blood clotting concerns, and again, the presence of undisclosed residual DNA contaminants.
It sounds sometimes like we're maybe exaggerating when we talk about how misinformation can be a life and death situation. And I know there's several physicians in the room, and I suspect you have similar stories, but I'm going to share a story from one of my recent hospital shifts where I work at a women's hospital, and we had somebody who had a postpartum hemorrhage after delivering a baby. So that's when you have a lot of bleeding after having a baby. It's actually the #1 cause of maternal death globally. And this person needed a transfusion to replace the blood she lost. And she refused that transfusion because she didn't want vaccinated blood.
At that same schmooze fest, Reimer outlined how her unelected, unaccountable organization funds and shapes a healthy news ecosystem through investments in health journalism and social media networks before pushing for more funding to the Public Health Agency of Canada to tighten their communication control too.
I mean, really listening to this panel, seeing recent news, seeing the US leave the WHO and the Paris Accords, I feel more concerned now than I've ever felt about the misinformation environment. But I want that to be a driver for change. I want that to be something that people take, and rather than just feeling that this is hopeless, that people feel like we need to be part of a solution, we need to move forward. And so I'll share a little bit. The Canadian Medical Association values a healthy news ecosystem and sees that as critical to the health of Canadians. And so we've invested in health journalism. We're supporting multiple health journalists in Canada. We also have our Healthcare for Real channels, which is our social media channels that try to demystify the healthcare system and provide it in a way that's easy to understand despite how complex our health systems are. We also have a social media network of support for physicians who are active online to try to give them a place where they can get support, where they can get access to information, where they can get advice on how to do this in a way that can reach Canadians. And we're tracking it like in the survey. So there's many things that we see as critical roles. Physicians, thankfully, remain the most trusted healthcare professionals, but that means that we have a duty to care. That means that we have the duty for the patient right in front of us, but for all Canadians. And we take that really seriously, and we will continue to invest in making sure that we're part of the solution, that we're part of moving forward on having these trusted sources of information in traditional media, but also on social media. And we also want to see, appropriate budgets for things like the Public Health Agency of Canada or Health Canada's communication budgets, because they still are trusted sources and need to be able to share information in an accurate way that Canadians can go to.
In 2024, after her jaunt to the UN's climate conference, she penned a LinkedIn post about the climate crisis and health, drawing 3 big takeaways on how global warming ties into public health threats. Look, I'm all for clean air and clean water, but when public health officials start blending climate ideology with medicine, it starts to smell like another layer of control disguised as virtue. Reimer sounds like a full-spectrum advocate for government intervention in every corner of our lives. That's clear when you look at her laundry list of lobbying efforts on the Federal Registry. From COVID-19 vaccination strategies, equitable global vaccine access, legislation to police harmful content online, an anti-racism plan, expanding state euthanasia plans, Indigenous reconciliation calls to action, and you can see the agendas she's pushing. Heavy on progressive ideology, big government solutions, and silencing dissent. She's not a neutral scientist. She's a truther in the worst sense, clinging to predetermined beliefs rooted in politics and dogma, not pure evidence. It seems pretty clear that Canada's next chief public health officer won't foster open scientific debate, transparent data review, and meaningful support for the injured. Instead, she's already made her plan known to double down on the same messaging strategy that eroded public trust in the first place. For Rebel News, I'm Tamara Ugolini. If you'd like to check out factual reports on the topic of what Reimer calls the human experiment, you can do so at nomoreshots.ca. There you can also sign a petition calling on our federal health minister to revoke market authorization for these modified RNA injections. That's nomoreshots.ca.